In this study, we tried to address the outcomes of allogeneic stem cell transplant in adults with PH-like ALL. And PH-like ALL, it's a newly described high-risk leukemia of B-cell ALL that they tend to be chemorefractory. There is high risk of induction failure, persistent MRD after chemo, and high risk of relapse afterward, even with the paediatric-inspired regimen. So in this study, we tried to see if allogeneic stem cell transplant can overcome this inferior prognosis of PH-like ALL, since we utilize transplant frequently for high-risk ALL to reduce the risk of relapse. So what we did here, we did a retrospective analysis of adults with B-cell ALL Philadelphia chromosome negative who underwent transplant between 2006 and 2020 at City of Hope in complete remission. And we only included cases with available archived leukemia genetic samples with DNA and RNA so we can sequence them to diagnose the PH-like status. Then we classify the PH-like versus non-PH-like cases according to the WHO 2017 classification using results from RNA-seq, conventional cytogenetics, FISH, and whole genome array. So we found we had 125 adult patients with B-cell ALL were included in the analysis. And we found that the incidence of PH-like ALL was high among these patients. We had 66 of them were PH-like, according to the analysis, so over half of them. And this is not surprisingly because PH-like ALL, it's a disease of Hispanics, and our population is rich with Hispanic. Plus, these patients were high-risk patients, end up going to transplant, which is a characteristic of PH-like ALL. So when we compare outcomes of when we compare characteristics of PH-like with non-PH-like, we found out that PH-like patients, they tend to be younger, more frequently Hispanics, they less likely have high-risk cytogenetics, more frequently receive blinatumomab before transplant, and more frequently induced with paediatric-inspired regimens, and require more than one cycle to achieve remission for patients transplanted in CR1. But other characteristics of transplant or disease were similar between both groups. So when we compare outcomes of PH-like with non-PH-like for the whole group, we found that relapse-free survival, overall survival, cumulative incidence of relapse, and non-relapse mortality were similar in both groups. For overall survival, the 3 years overall survival, it was 54% in PH-like ALL. And when we restricted analysis to patients transplanted in first remission, we also saw comparable outcomes between PH-like and non-PH-like. And the 3 years overall survival in PH-like transplanted in CR1 was as high as 70%. And at least since with the chemotherapy treatment, the CRLF2 subtype of the PH-like usually drive the poor prognosis, we did the analysis again, comparing patients with PH-like either with CRLF2 and non-CRLF2, and we saw actually comparable outcomes between both groups. However, patients with CRLF2 rearranged PH-like ALL, they had a tendency to have higher risk of relapse after transplant, which was as high as 40% post-transplant. And when we look at multivariate analysis, PH-like did not impact any of these outcomes. Yeah, so our results actually are very encouraging for this high-risk subgroup of B-cell because they don't do well with chemotherapy. And here we show that transplant outcomes very encouraging. We're able to have 3 years overall survival exceeding 50% across all the CRs. And for patients transplanted in CR1 was 70%, the 3 years overall survival. And this is much better than what we see with chemotherapy. So our results, with our results, I think allogeneic stem cell transplant should be considered for patients with PH like ALL in complete remission. So what's next in the study? I would say there are two things. We're seeing high risk of relapse for CRLF2 rearranged patients with PH like ALL. So I think we have to conduct studies looking at both transplant, preemptive, or maintenance therapy to reduce the risk of relapse for these patients and possibly improve their outcomes. The other question that comes from this study, we couldn't address the outcomes, the benefit of transplant in patients who achieve early MRD response with chemotherapy. So I think there has to be a study looking at outcomes of transplant versus non-transplant in PH like ALL who achieve MRD negative response with modern regimens of chemotherapy to see if transplant is still needed for these patients or not.